Thank you for tuning in to our second Facebook Live with rheumatologist Dr. Samuel Pegram and our founder and president, Dr. Mark Malone. Please begin submitting your questions for either physician, and we're going to get started.
Good morning, everybody. I'm Dr. Mark Malone here with Dr. Sam Pegram. I've known Sam for about 35 years. We trained together at Baylor University in Houston. I went on to specialize in pain management. Dr. Pegram went on to specialize in rheumatology, and I'm glad to have him with us. A lot of our pain patients have rheumatology issues, especially joint disease and arthritis, and it's hard to find a rheumatologist these days, especially one as great as Dr. Pegram is, so we're extra glad to have Dr. Pegram with us.
Pleasure to be here.
Alrighty, well, let's go ahead and get to our first question. Dr. Pegram, what exactly is a rheumatologist and what kind of illnesses do you treat?
Besides being handsome, debonair, and above all things modest, I digress. What a rheumatologist actually is, starts off life actually as an indentured servant, spending 3 years of their young life training and learning about disease of internal organs. They then incubate for another 2 to 3 years, depending on the program, studying inflammatory conditions that affect those internal organs. And so a rheumatologist is basically a physician who studies and treats inflammatory diseases, autoimmune diseases that affect internal organs.
Alrighty, this next one is for Dr. Malone. So I have a patient here that says, I'm already seeing a pain doctor for my back and now I have arthritis in my hands. Can I still see both doctors, Dr. Pegram and a pain doctor? Do they work together? How does that work?
Absolutely, we do work together. In fact, it's likely you could see both of your doctors on the same day in the same location. Dr. Pegram works with us here at the Georgetown Clinic. We also staff the clinic with pain doctors and orthopedic surgeons. So if you have back issues or joint issues or other rheumatology issues, we can see you all together.
Dr. Pegram, what can a patient expect at their very first office visit with you?
What we do, the main focus here at Advanced Pain Care is to make an accurate diagnosis, because making that diagnosis is how we determine the best modes of therapy. So the first thing they can expect is a detailed history and physical exam. Then they will also have appropriate laboratory data to confirm what we suspect on that exam. And then also radiographic studies if needed. They also we can initiate therapy that same day, including intra-articular injections, prescriptions of medications. So you get it all in one package, and that's the nice thing about advanced pain care. All of those modalities can be enhanced and taken care of during that single visit.
So our next question you just touched on, why are labs and x-ray tests important to my care? And where do I go and get those done if I'm a patient?
Rheumatology is a really heavily lab-laden specialty. I mean, most of our diagnoses are made by histories, physical, and laboratory. So laboratory tests, unfortunately, are mandatory, but they allow us to make a specific diagnosis, and that's the key. The nice thing is that we have phlebotomists on staff here at the facility. Also, that allows us to make decisions in real time. If we get that data early and often, then we can make appropriate changes in our therapy and more specific therapeutic modality changes right at that time.
All right, a question just came in. Is it hard to get in to see you, Dr. Pegram?
No, fortunately, we have been very blessed by having an aggressive staff that has managed to get patients in on a timely basis. We are, at this point, seeing patients at 3 different locations, so we're available to patients all over the area. And we sometimes come in a little early and we stay a little late if need be to make sure we take care of the patients here at APC.
Wonderful. All right, this next one is for Dr. Malone. Is it safe to come in for my appointment or infusion, and what precautions are y'all taking for COVID?
Absolutely, I feel like it is very safe. We take all the precautions, including our staff wears face masks and gloves. We ask that patients wear face masks when coming into the building. We ask that family members and friends stay behind to limit the number of people in the building. We maintain social distancing. We room the patient immediately upon check-in, so there's no going to the waiting room. In the last 7 to 8 months of this COVID outbreak, Our staff has maintained a great safety record. Only a very few have ever tested positive, and none of those have become seriously ill. So we feel like our precautions are very effective.
All right, Dr. Pegram, we have another question for you. What does immunocompromised mean, and can a patient still live a normal life?
Absolutely. First, immunocompromised, the immune system is your protection. In fact, the word immune comes from the Latin word immunis, which means to be exempt or to be protected, such as that the people in Rome were immunis, so they didn't have to pay taxes, or they were immune, exempt from having to serve duty in the military. So immune is your protection. When there is, in fact, a immune compromised patient, that means that protection is limited. Most of the immune compromised issues in rheumatology, unfortunately, is due to us. It's the medicines we give them that often downregulate the immune system. Most inflammatory conditions are quite the opposite. The immune system is hyperactive, and we're trying to settle that immune system back down to normal. These patients can, by all means, live a totally free and functional lifestyle. The key, again, is to make the diagnosis, put them on appropriate therapy early in the course of disease, and they will do fine. During the time of COVID, it's also important to note that there have been no recommendations by the American College of Rheumatology about not treating patients aggressively and effectively during this time in our particular lifestyle here in the United States. And so there are no additional precautions necessary except those as mentioned by Dr. Malone: adequate face coverings, good hand washing, social distancing, and the normal things we're all doing now.
All right, so we've all probably noticed that the word telemedicine has almost become a buzzword in the time of COVID. Dr. Malone, can patients still book telemedicine appointments?
Absolutely. We do offer telemedicine visits for people who feel like they may be at increased risk, or for anyone who really feels like it's safer to stay home. I was very surprised that very few people are actually asking for telemedicine. Most of our patients do want to see their doctors and nurses in person.
All right, Dr. Malone, one more for you here. What if a patient is confused on what specialty that they should see, what specialist they should see? Do you have any recommendation on how they can pick that when they call in to schedule that appointment?
Absolutely. We do specialize in the proper diagnosis, just as Dr. Pegram mentioned. We're happy to see any patient with a main complaint of pain, especially chronic pain. If our investigation reveals that you have a rheumatology component, we can walk you right across the hall to see Dr. Pegram. We also have neurosurgery and orthopedic surgery for those of you who may have a cervical condition.
Dr. Pegram, what are biologic medications and are they safe?
Biologic agents have been the greatest advancement in the treatment of rheumatologic illnesses in the past 20 years. They are basically medicines that are made of fine biologic material that is designed to affect a specific aspect of that particular patient's condition. They are more specific, targeted medications that in essence have actually less side effects than the medicines we've used in rheumatology in the past. Their biggest concern, or our biggest concern with the use of these medicines, are infections, but fortunately these are not types of infections we generally see, such as colds and flus. We do have to annually evaluate these patients for things like tuberculosis or hepatitis. But biologic agents are much more effective, and most importantly, they finally give us an opportunity to put diseases into remission, which we never had that opportunity before.
I have another question about medication. So this patient says, do I have to keep taking medications forever if I feel well?
That's an excellent question. Before, I would tell patients, yes, you're going to be on medicines a long time. And unfortunately, most rheumatologic illnesses are chronic in nature. But finally, we now are in a position with the advent of biologic agents to where we can actually discuss remission. So some patients actually do go into remission, or we can gradually back off of medications. But in rheumatology, we should still keep in mind that most of these are chronic illnesses, but that doesn't mean that life doesn't go on. Life expectancies have improved considerably, and functional capacity is our greatest concern.
Wonderful. So You might have touched on this just a little bit. When a patient comes in as a rheumatologist, what exactly are you looking for?
Well, we're looking for several things. We want to look for to differentiate between structural abnormalities and inflammatory abnormalities because the types of therapies are considerably different. The wonderful thing about being in a place like advanced pain care is that if we do define an inflammatory condition that has resulted in a structural deformity, we have at our disposal orthopedic surgeons who can handle those types of structural abnormalities. We also know that our armamentarium is limited in some extent, that we can control symptoms of the disease, but we may not make all of their pain go away because of those structural abnormalities, and we're surrounded by a group of obviously talented pain specialists, so that's also a benefit as well for patients who see rheumatologists here at APC. So we're actually trying to make sure that we cover all of those bases, the inflammatory component of their illness as well as the structural component.
All right, so this is a three-parter. What locations do you treat patients at? Do you take TRICARE? And do I need a referral?
Well, I'll answer some of this. I see patients here in the Georgetown location. On Wednesdays, I'm in Killeen, and then on Fridays, I'm down in the South Clinic. And so we're at those three locations. As far as those other options, I'm going to defer that to our expert here, Dr. Malone.
We do absolutely take TRICARE. And what was the third part of that? Sorry.
Do they need a referral?
Some insurance does require a referral, but most do not. So if you're not sure, just call us and I'm sure we can get you on the schedule.
So I actually just had a follow-up question come in. Do patients that are uninsured, can they still come? Is there any kind of plan to help them through payment options? Do we have any options in regards to that?
Absolutely, there are always payment options. We have specialists who specialize in payment plans, payment options. So if you're in doubt about whether or not you can afford our services, please give us a call. We'll work something out.
All right, Dr. Malone, another one for you, and this is kind of a hot one. So this patient says, no one believes that I am suffering. Why should I expect to be treated any differently at APC? So this sounds like this person's had some bad experience at maybe other pain clinics.
Yeah, we do hear that a lot. One of the biggest problems in chronic pain is that people don't believe you when you say you're suffering, you're hurting so bad that you can't get out of bed. We do believe you. I've been in that position myself. I had a pretty serious back injury 10 years ago and struggled along with it like many of you have struggled. I eventually found excellent pain relief with a spinal stimulator. That's a great way to go if you have spine pain or nerve damage pain, which a lot of people have. So yes, we do believe you when you say you're suffering and you can't get out of bed. Give us a call. I'm sure we can help you.
If I could add something to that.
Please.
You know, in this day and time with politics, empathy is a big word that's been thrown around a lot. And I've been very impressed since being a part of this team that empathy is a big part of I think, our culture. Patients with pain are sometimes difficult patients to deal with, and it's hard to be chipper when you're hurting all the time. And so we understand that the attitude of the staff here, the physicians, is one that we always take their complaints of pain seriously. We attend to that promptly, and I think we got the best odds in the world to attend to those things here at APC.
Absolutely.
All right, Dr. Pegram, the million-dollar question is, can I be cured of arthritis? Your thoughts?
Depends on what arthritis. Yes, most arthritic and inflammatory autoimmune conditions are unfortunately not curable, but that doesn't mean they can't be treated to the point where patients live a totally functional and mostly pain-free life. Our goal is to make sure we maintain functional capacity. It's not just a matter of putting patients on medicine and say, take this pill and do the best you can. We want to ensure that not only do we attend to the inflammatory process that's at hand, but we want to do everything we can to make sure patients remain functional. That's why it's important that we treat all aspects of their disease, the inflammatory component, the autoimmune component, which is where rheumatologists basically do their work. We use the orthopedists to take care of those joint processes that we unfortunately could not save with our types of medical therapies. And then in those joints that unfortunately don't quite do well with just medicines and orthopedic intervention, our pain specialists then help those people to stay on their feet. So it's really a combination therapy with combinations of specialists that allow these patients to maintain functional capacity throughout their life.
Dr. Pegram, is there a place where a patient can go to learn more about living with the disease? Do you have any recommendations there?
Yes, in these various disease processes, fortunately, there are institutions that are basically patient-driven and are advocates for patient care. The Arthritis Foundation, the Lupus Foundation, there's a Spondylitis Foundation. There are a number of local foundations for specific arthritic conditions that patients can access at any time. You can find these on the internet, and they would love to assist you in those areas. Also, talking to your doctors. Your doctors are also able to direct you to some of those areas where you can get some support. And I think it's important to do that because it's tough living with chronic illnesses, and so having the support of other patients with these illnesses is very important.
I had a question come in on Facebook. It says, I'm often told I am too young to be in pain. Is it possible to have arthritis in my knees at 30?
Unfortunately, inflammatory forms of rheumatism, including rheumatoid arthritis, systemic lupus, are actually diseases of the young. Most people develop these illnesses in their mid-20s to their mid-40s. People often think of the word, quote, arthritis as that being the conditions of the elderly, but they are not. They are diseases that start earlier in life, and if we are to attend to them, if we attend to them earlier in life, their prognosis over time is much better. So if you have articular discomfort, you do not want to, quote, tough it out, end of quote. You want to go in and see your doctor early in the course of your illness, allow your physicians to initiate therapy earlier in the course of the disease, and you are likely to prevent joint destruction over time.
I'd actually love for both of you to answer this next question. It is, are there lifestyle changes I can make to improve my symptoms, such as exercise and diet?
Absolutely. If we look at one of the biggest detriments to improving degenerative joint disease, it is weight gain. So maintaining a healthy diet, exercising routinely, and keeping weight under control is probably one of the biggest advantages to ensuring that we do not get progressive joint destruction. Also, these autoimmune diseases are multi-system conditions, and so they affect the heart, the kidney, the lung. And so when one is able to maintain appropriate therapeutic interventions with their internists, their family physicians, making sure that blood pressure is maintained at good levels, making sure that weight's attended to, good healthy diet, all of those things help us in maintaining success in multi-system illnesses. So it's very, very important.
Absolutely, I agree wholeheartedly, Sam. Weight control is very important. Moderate exercise is very important. If you're smoking, it helps to stop smoking, which helps improve your immune system and your ability to heal. And so all of these things are important.
All right, I just wanted to take a pause and say a quick thank you to everyone out there watching on Facebook. We're going to be able to take just a few more questions, so please submit those. And then we're going to go back to Dr. Pegram. How did you decide to practice in this field? What drew you to rheumatology?
There's a couple of things. One, rheumatology, the disease processes are interesting because they are multi-system illnesses, so there is some, I guess there's some intellectual curiosity that goes along with it, because sometimes the diseases are sometimes difficult to actually make an accurate diagnosis. Two is that, I know it doesn't sound right that you have fun with chronic illnesses, but in internal medicine, you actually like the idea that you get to follow patients over time. And now that I'm getting long in the tooth, you're seeing patients, you're seeing their children, so that part's not so great. But having an opportunity to know patients over time and see their success and improvement is truly fulfilling. And so that's one of the reasons I like being in this specialty where you have chronic illnesses.
Dr. Pegram, could you explain what an infusion is and how it can be helpful in the treatment of rheumatological diseases?
Yes, infusions are where we take the medicine directly into the vein. Oral medications often have to be broken down through the digestive tract, go through the liver to be metabolized, and then they get to the point where they can do their work. When we can take a medicine and infuse it directly into the vein, into the patient's system, they often work quite more rapidly. They often have a little more punch behind them. And so infusible products are often of great benefit. They sometimes are much more efficacious than oral agents. They also allow us to help those patients who have, unfortunately, medical means that will not allow them to tolerate oral medicines quite as well. So they provide us some advantages that we often don't have with oral therapy.
So we just had another one come in by our Facebook chat. And I think this would be wonderful for both rheumatology and pain management to answer. Are there supplements a patient can take to help kind of aid at home whatever symptoms they might be experiencing? So inflammation, pain.
There are a couple. Turmeric is actually not a bad anti-inflammatory agent, which I think a lot of people use. Dietary fish oils also have anti-inflammatory properties to them, so those are beneficial. We cannot, in rheumatology, there is no so-called anti-inflammatory or autoimmune diet. The most important thing, as Dr. Malone mentioned, is maintaining a good, healthy diet to keep weight under control. But those simple supplements are not bad things to have. Vitamin D is also important because it sort of keeps the inflammatory process under control, so maintaining good vitamin D levels is important. So I think all of these simple things, and then also because of some of the medicines we use, like corticosteroids, osteoporosis is a consequence of the use of those products, and so good calcium metabolism is important. So having calcium supplements as part of your routine is also beneficial.
I agree with all of that, Sam, wholeheartedly. CBD oil is something that's been in the news a lot lately, and many of our patients do get positive results by using a little CBD oil. And I've seen a lot of positive results with it.
All right, doctors, we're actually about to wrap it up, so if there's anything additional you guys want to add to our Facebook audience.
Well, we just want to encourage everybody who's suffering from chronic pain to come in and see us. There's no need to suffer. We're always here. We're open 6 days a week, multi-specialty team that will take care of every issue in the world of chronic pain.
We do good work here. Why would you want to go anyplace else?
Absolutely.
All right, y'all, that's a wrap for our second Facebook Live. We appreciate you tuning in and participating.